Hi, everybody. I'm so excited to see y'all again 3 days in a row. Listen, we're super excited about today's webinar because, we all need to have procedures in place to deal with this craziness that is far beyond anything that we could have ever imagined. So, let me tell you a little bit about my good friend, Dr. Scott Munsterman, who is our presenter today. He is the founder and CEO of Best Practices Academy as an acknowledged expert on the transforming model of healthcare delivery with a commitment to the promotion and advancement of the chiropractic profession. And to be honest, yes, he is, but he is on the forefront of all of the changing things that are going on within this profession right now and in healthcare. He graduated from Northwestern Health Sciences University, where he also has a daughter who is attending chiropractic college. He has also served as the vice chair of the board of trustees and on the president's cabinet as chief care of delivery. He's kind of the man. So without further ado, we are going to get started with today's presentation. And also just remember, hundreds of y'all, one of me. So I will try to answer your questions as quickly as possible. Just know that this webinar is being recorded. You will all get a link to the recording. You don't have to request it, and the handouts will be available in just a few minutes. All right, everybody, here we go.
Well, welcome. My name is Dr. Scott Munsterman, and we'll be visiting about a strategy for your COVID-19 response. And we use the word response. I think we could largely agree that there's been a lot of reaction around this public health crisis, and that's fine. But there's a point in time where we have to step back and take a pragmatic look and a prudent look at how do we respond to this public health crisis. And so, first of all, I just want to give a special thanks to ChiroArmor and eChiro and ChiroHealthUSA and Best Practices Academy for stepping up. And there are many more leaders within our profession that are pulling things together and getting them out to all of our colleagues. And certainly it's at a point in time where we all need to stick together and work together to get through this crisis and get through this point in history, which we will. All right, we will. And so I just want to say that I only know what I know. We've got some great background. We have some awesome people who have a level of expertise that, as we've done the research in this area and assimilated it and digested it and all of that, we are giving you the most updated information and probably the best approach for you and your practice. And so let's talk a little bit about that. All right. I love the statement by the Federation of Chiropractic Licensing Board when they came out and said that chiropractic is considered essential. We are essential healthcare providers. And as we think about that, each state will be making that decision as shelter in place may end up becoming common here over the next week or two as states experience increase cases that they've identified and probably getting a better handle around testing and all of those things. And essential services will be defined on that statewide level. And so we have some states like our colleagues in Kentucky that chiropractic, unfortunately, was not deemed as essential service, but we have other states that it has been. And we're going to talk that through. What does that mean? Well, this strategy that we're talking about will pertain to you whether your practice doors are open or closed. All right. And so it's going to give you a pretty good idea of how do we approach this? How do we work our way through this and come out of it stronger, which I truly believe that we will. And there will be silver linings in these dark clouds. And the big thing for us to keep in mind is that we need to replace fear with knowledge, frankly. And we need to just approach this thing from that standpoint. Let's learn as much as we can. Let's stay informed. Let's visit with those people who have specialized expertise that are bringing this information forward to us. And so that's going to be our call to you as our colleagues to stay informed and really think this through. All right. And what was interesting in my state, Dr. TJ Stotz, president of the South Dakota Chiropractors Association, sent this out yesterday, and I asked for his permission, and he graciously granted it. And essentially what they learned was that they had a city ordinance that was going to be enforced that would have caused them to close. And so here's the thing, folks, is that we have to keep our eyes open on the local level, state level, as well as national level, and pay attention to what's going on in your community. And we're going to talk about a public health strategy here further on in the module. But what should our strategy be to weather through this storm of COVID-19? Well, we've laid out a three-point strategy or response that we're going to talk about as we think about how to approach this. How do we work through this until we get to the other end of that bell curve that everybody talks about trying to flatten, right? And so we've got the clinic facility response. What do we do with the clinic? The patient care response, how do we take care of our patients, and then a public health response, which I think you'll find maybe a little bit interesting. And so what's our clinic facility response? Well, first and foremost, it's to create and maintain a safe clinical work environment. And of course, we put out training modules on this right away early last week. Many of you have already downloaded that, watched that, have put it into play. We based it off of the World Health Organization criteria and Centers for Disease Control, and that training is available to you. Of course, no cost for any of this information, and it was put together. You can go to this landing page right here. You'll see on the left-hand side of the screen, I've circled a couple of key areas and you can see the training module there, and that'll help you and your staff understand how to keep a clean and safe environment. And we'll touch a little bit on that now, but it's about a 20-minute video. And then there's tools that you can utilize. There's links that you can go to that will help you download some specific information from the CDC as well, that you can hang signs up in your clinic, on the door, and all of that. And then if you would like to stay in the know, we also do have a spot where you can put in your name and your email, and then you go on our update list, which is strictly only used for this COVID-19 time that we have. So anyway, resources available, and throughout this presentation as well, I will point out links and resources that will be great for you to migrate through and again learn as much as you can. And so as we think about maintaining and creating a safe, clean clinical environment, what are we talking about? Well, we have an OSHA requirement here that we need to fulfill, and that is that we need to understand that this whole situation has created occupational exposure for us and for our staff. And of course, OSHA defines occupational exposure as the reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or other potentially infectious materials. And so other potentially infectious materials would be saliva, that type of thing, and body fluids. And so we have to understand that we have to do everything we can to limit exposure, and that means implementing safe work practices, both for staff and for doctors. And so there are some policy considerations for you to take under consideration, if you will. This is a great link to the CDC, and that you will get this PDF, and it walks you through how do you get your clinic ready for the coronavirus, and how do you prepare the clinic environment and disinfecting and all of that. And so I recommend that you go ahead and download that. Again, we cover that in the training module that we talked about here just a moment ago. But this is a great download as well to help you prepare your clinic during this time and seeing the patients that you do see coming into the clinic. Now, the other thing we have to think about, obviously, is our operations. All across the board, our clients and other doctors that I've visited with, they've had anywhere from a 50 to 70% reduction in their patient volume right now. And it depends on the state. It depends on how many cases have been reported and all of that. And of course, it leads us to understand that under a clinic facility response, not only do we need to create a clean and safe clinical environment for everybody, patients and staff and doctors, but as doctor owners, we need to understand that, okay, there's a point in time where the numbers may not work to have staff there, obviously. And so it's all about analyzing budgetarily, how do we move forward over this next month or so? And again, nobody has a crystal ball. They don't sell them at Walmart anymore. And so we don't know what the end is going to look like or when that's going to be, but there will be the end of this bell curve. But until that time, it's understanding what do we need to do to operate, keep our doors open from a budgetary perspective, holding back on essential purchasing. And then if shelter in place has been mandated or not, are there any restrictions placed in the practice? All of these things can cause consideration, obviously. And so what we've done is we've listed some resources here, and we're going to talk about some resources later on as well in this module. But as you know, that just within the last day now, there was a $2 trillion package that was passed out of the Senate, should be passed out of the House and signed today, and certainly that has provided and will provide access to funds and to a lot of help. And so keeping your eye open on that, the disaster loan through the SBA, unemployment insurance, some of the things that have come down the pike on that for self-employed doctors, self-employed business people, and then looking at how can you get your hands on some working capital for now. Well, NCMIC is a working capital loan. You can talk to them about that and get updates from the NFIB as well on what's going on within the whole business community and this response. And so as you think about your clinic facility response, remember that's kind of our first point here. If we're open, maintaining that clean, safe environment for everybody, seeing patients that need to be seen, which we'll talk about next, who are those folks, and then also understanding the business side of the equation. How do we maintain our operation? What are the things we may be able to take advantage of? How do we plug this hole until we get to the other side? And so as we think about that, let's move on to the patient care response. And of course, patient care response is our clinical work as we see people during this crisis. And the very first thing is screening our patients and making sure that we do and put into play those clinical assessment measures so that we can identify any patients that have been or potentially could be infected with COVID-19. And of course, those clinical symptoms, we understand now, fever, cough, shortness of breath, the vital signs from our clinical assessment side of it. It's taking their it's taking their body temperature. Go ahead and include all of the vitals: blood pressure, pulse, respiration. All right. Observation, questioning travel, family, social history for potential exposure. Further in this module, we'll talk about quarantining and what are some of the guidelines that are available right now that we need to understand. And it's identifying that screening and clinical assessment of those patients to identify if they have those warning signs of COVID-19. And of course, there are emergency warning signs for COVID-19, which we need to be aware of, which demand immediate medical attention. And that's difficulty breathing or shortness of breath, and persistent pain or pressure in the chest, confusion or inability to arouse, and then, of course, bluish lips or face. And these are emergency warning signs of COVID-19. And then we need to be aware, too, that we have patients that are in that at-risk patient population because of their comorbidity factors that are involved, and that's blood disorders, a kidney and liver disease, and a compromised immune system for whatever reason, current or recent pregnancy, any endocrine, metabolic disorders, heart, lung disease, or neurological types of conditions. And so screening these folks out, do they need to be out? Do they need to be about? And again, we're kind of in the midst of shelter in place, getting into play, but this is something that we need to keep our eye on, is a watchful eye for our patients who are certainly at risk for having a devastating impact on from the COVID-19. And as we know, there aren't any specific antiviral treatments currently or vaccines available. All of that is a work in progress. So let's talk about the quarantine recommendations here so that we can understand what those current guidelines are. And so a 2-week self-quarantine is recommended if someone's been in contact with anyone who exhibits any of those symptoms. And of course, fever, 100.4 and above, a cough, respiratory or bronchitis, respiratory infection, sore throat, shortness of breath, any digestive complaints, vomiting or diarrhea, and then, of course, severe fatigue that isn't related to to really anything else. And so a 2-week self-quarantine is recommended if someone has been in contact with anybody who has those symptoms. Now, a 2-week self-quarantine should be recommended if there's a history or high risk, which we covered a bunch of that already. So if they're a high-risk patient right now, they should be under a 2-week self-quarantine just to stay away from the potential of being infected. And then, of course, a 2-week self-quarantine is recommended if you or anyone you know has symptoms of COVID-19, waiting to be tested, maybe waiting for test results. Maybe they've tested positive for COVID-19, or if they've traveled on an airplane in the past 2 weeks. There should be a 2-week self-quarantine that's recommended. And then the other thing that we're recommending as well is that you document your clinic's experience and what you're doing during this public health crisis. Document how you're being proactive in protecting and identifying people, that you put screening into play, you've got your clinical assessments in order, you're wiping down your clinic facility where patients commonly touch things, you've got signs up in your clinic, you've rearranged your waiting room to have fewer chairs and further apart, or maybe what you're doing with, like some docs are doing, they're texting their patients, they're in the car, they come in and they've got them where they're treating one patient at a time, that type of thing. And so use some of your pragmatic sense about you and say, okay, here's how we're going to do things to try to lessen the impact, bringing people right back into a room, doing the assessment, doing the screening, all of that. Of course, report any suspected individuals, State Department of Health, if that's necessary. Chart that patients and practice members were questioned in regard to recent travel, your screening results. So far, with all the clients that we have and the doctors that I've talked to that have been implementing screening, there has not been a positive screening yet, but we do suspect that will change as time goes on. So, but we'll see how that rolls out. But to document your experience and what you're doing on a daily basis, almost like a diary, if you will. We suggest and certainly recommend that strongly so that you have that information available at a later date, just in case somebody is asking, how did you respond to that? And you will have that answer for them. Now, as we think about patient care, we have to think about, okay, what are the urgent needs for evaluation and care? And so it all boils down to, if we are defined as essential services within your specific state, then we have to move on to the conversation or discussion about triaging patients who are currently under active treatment. And what we recommend is that you focus on your acute care patients for now. Patients that you may have under maintenance therapy, wellness care, that type of thing can be moved down the road. And we'd recommend you scheduling them out maybe 2, 3, 4 weeks in advance. Push them out there a ways. Everybody understands what's going on, but our focus as a profession should be on those acute neuromusculoskeletal patients that need us. And of course, why are we essential at this stage of the game? Well, for 2 reasons. Number one, we all know that there are typically high numbers in emergency rooms and also to other medical providers for back pain, right? And headache. And so those providers, our medical colleagues, are busy taking care of COVID-19 patients and will be. And so we are here to help that whole public health side of it, that we can take care of those non-life-threatening neuromusculoskeletal complaints that are acute in nature. So number one, we can take a load off the current medical system in that area by helping with those patients. But then secondly, we have our patients that are under active treatment that are in acute stage, that we really can't put them off. I mean, we all know that if you prolong the acute pain stage of a condition, that it has the potential for chronic issues down the road and increase in disability. And so as we think about what is our duty as clinicians, if we are able to practice and keep our doors open and see patients coming through those doors, well, it's for sure for those acute patients and certainly to help lessen the load on the healthcare system. And of course, that's going to mean that that we need to know judiciously how do we schedule those visits, all right? Any ancillary services that we may typically provide, like massage therapy and some of those, should be suspended really at this time. And then looking at providing more self-care management instruction for patients, and also have a consideration to begin implementing telehealth. And then, of course, lastly, it's all about, okay, when do things get back to normal? And when is a timely reentry of our in-office active treatment visits? When can we begin that process with patients and kind of get back to normal, if you will? But under the patient care response, we need to be thinking about all of those things as providing that essential care that is absolutely only necessary now. And of course, that would be for our acute patients, obviously, but then to reach out to our patients, which let's talk a little bit about what that may look like. And so we recommend that you stay connected to your established patients who are under a treatment plan. You know, maybe they're in the subacute stage and you've got them started on some therapeutic activities and procedures, or maybe, you know, they're further out and more in the chronic stage of your treatment plan and getting to the end of it. Well, we recommend that you stay connected with them and that you follow telehealth guidelines. And of course, an established patient is what we recommend that you focus on right now in terms of telehealth. Lots of guidelines around that in terms of established patients, and there's a lot of changes going on with telehealth regulations and the loosening of what you can do and how you can perform it. And we go into greater detail on that on a separate module, which you'll have a link for here shortly. But the key is to maintain that connection with your established patients. The ones, again, under current treatment plan, maybe those that are reactivated, they're calling in, they're like, I can't wait any longer. You know, things are getting bad. I have to be seen. And they definitely would need to be seen and evaluated. But stay connected with them. Now, telehealth has been around for a while, right? And it has just recently become like in the last few years, much more popular and used. And of course, what are we talking about here? Well, we're talking about telecommunication technologies, video, audio, that allows us to, through video conferencing and the internet, and there's a wide range of forms of telehealth that we can connect with patients to get the job done, or at least some of the job done. Now, obviously, we're not talking about adjusting patients through telehealth, right? But we do have evaluation management services that we can provide, clinical advice we can provide, and we can also monitor and supervise therapeutic activities. Now, again, there is a lot to learn about telehealth. And it takes a good process to work through to understand all of the components. But you will hear the terms interchange, like telemedicine, telehealth. What's very key here is that you understand that each state has specific guidelines, and so your state may be different than my state. Matter of fact, I can almost guarantee it will be. And so the module that we put together walks you through a complete analysis of what to look for within your state. But just look at this curve and how quickly it has gone up here over the last several years in terms of the provider to patient contact in the non-hospital setting. And there's just a huge growth. Well, this point in time, moving forward, you can mark our words that telehealth will become another lever in the practice to be able to work and instrument and tool within the practice to be able to conduct patient care and follow through. And so in the module that you'll have the link to here in just a moment, we review your state current requirements. We provide you access and links so that you can understand that. Informed consent has to be done in every telehealth visit. What's the licensure requirements? What are the HIPAA guidelines? HIPAA has loosened up in that area, but you need to know exactly what they've loosened up on and what they haven't loosened up on, all right? Malpractice, risk management, reimbursement, and then, how do we go about performing, documenting, coding for that telehealth visit? Well, it's a whole part of the business model within the practice that it is a great time for us as clinicians to be able to get our arms around that. And so this link, sponsored by eChiro EHR, thanks to them, they have provided this to you at no charge. And so go ahead and click on that link. You'll be able to watch a module on telehealth. There will be subsequent modules that will follow to help you understand how you can implement this. Again, we believe that this is one of the silver linings in this public health crisis cloud that we can begin to understand better and hopefully be able to implement, provide really great services to our patients through telehealth. So we talked about the clinic facility response, and we talked about the patient care response during this COVID-19 crisis, all strategic moves, right? And then now let's talk about the public health response, okay? And before I jump in the public health response, one last comment that I just thought of here in the patient care response. If you're in a state where your clinic has been shut down, or maybe for whatever reason you have a high number of reported cases or whatever, and you just haven't felt comfortable, and you just said, I gotta lock my doors, you can still make home visits. All right, if you have acute care patients, glove up, mask up, go to their home and take care of those folks. All right, and that's what we mean by staying in contact with your established patients. Follow up with them, and again, utilize tools like telehealth where you can do some billing through that. Of course, understanding it first, get up to speed and all that. But just keep in mind that just because maybe your doors have been closed in your clinic per se, it doesn't mean that you stop being a clinician. And so we encourage you to be a clinician and to be that clinician that you always have been, right, in the past. So let's talk about a public health response. Well, where are you going with that, Scott, right? Well, number one, and first and foremost, look around you. I mean, I've been so proud of some of our colleagues. What they've done is that they've looked around outside of what's going on with them and their business, and they've said, they've raised their hand and they said, hey, I can help my community, or I'm willing to help. I'm willing to come alongside other leaders in the community, the state, or whatever, and say, okay, what is a plan for our community, or how can I be of help? We have some great clinical understanding and knowledge base, and let's use that. Let's share that with the public. And secondly, is that, again, I can't emphasize enough, connect with your established patients, especially over the last 36 months, and engage and educate them with real-time information about this public health crisis. It's all about what's going on right now. What can we do? What is our public health responsibility? Do you feel that as a clinician? And especially for your patients. I mean, our patients that love us and we love them. Well, what better than to go back and look at who we've seen in the last 36 months and give them a call and ask them, Sally, how are you doing? We got a lot of stuff going on. Just wanted to check on you. Do you feel like you understand, what's going on with COVID? How are people doing in your household? Screen them. Have you had any of these symptoms? Is there anything that we can maybe help you with? And again, just calling to check on you and begin that conversation with them. Again, asking them the questions, providing them with resources. I mean, there's resources now. You can get their okay or authorization to email it to them, or however they want to get it. They can download it, give them the link. If they do have something clinically going on that you've identified that you can help them with, then scheduling a telehealth visit, or if you felt like maybe it would require an on-site physical evaluation by you if you're not under the the shutdown, if you will. But triaging those patients and helping them, they need a voice of reason coming into their home right now and talking to them, and you could be that voice of reason for them. And of course, there's some great self-care management for patients with COVID-19 that you can share with them and all of that. And so these links are very helpful. And just be the clinician that you are with your patients. And then as we reach out to our established patient base, What do we do if they express a clinical need? Well, the very first thing that we need to do is obtain consent from them to schedule a telehealth visit with the doctor, and of course, informing the patient that it's a billable visit, provide them with the necessary steps for the visit through a HIPAA-approved technology. Again, in this particular area, we go into at length in that module that I referenced earlier with the link and talk about all of those key areas. And we just recommend that you get some good groundwork done around those key areas, understanding your state law, understanding what your payers are recommending. I had my insurance agent call me just a few days ago. And she said, Scott, she said, I just want to let you know that your insurance plan issued the policy that your copay and your deductible is waived if you have telehealth. If you need a doctor visit or whatever, that you can use telehealth and it's completely covered. And that's not just my insurance plan. It's beginning to become commonplace. Matter of fact, the Division of Insurance, at least in my state, has laid out things that they're requiring the insurance companies, and it's more of a, this is what we recommend, wink, wink, we want you to do this, and that is one of the things that they've requested that they do. And so we're going to see the more accessibility and more encouragement in the area of telehealth. And so again, strongly consider it. Some of you docs are going to say, yeah, that's easy. That's great. I'm going to go for it. Others may say, gee, I just don't really understand it. Well, it's good time to research that out now and think about how we can work on our practices to get ready for when this thing is over. And so one last thing, and actually when I wrote that slide, I still haven't changed it yet. It's more than one last thing, so I kind of apologize a little bit for that. But what are some of the last things we need to talk about? Well, first of all, liability and risk management. This needs to be said, and if you're upset with me for saying it, so be it. But the fact of the matter is that we have to be extremely, extremely careful right now what we say, what we email, what we post on social media. Because you will be responsible for it. And what I'm referring to are the claims that maybe some colleagues have made, improving the outcomes of, cure, prevent, or in any way affect patients, or in any other way affect patients with COVID-19, coronavirus, or their families. These claims are being considered by the FTC as possibly false or fraudulent, and they can place our public at grave risk. And so just keep in mind that now is not the time to have that conversation. Now is the time to educate, come alongside of other leaders on this public health crisis regarding COVID-19, play our role in the area of acute care and helping lessen the need on the neuromusculoskeletal, help our, with the public effort, help our patients, understand what's going on. And let's just help get everybody through this crisis. There's a later time to look at the efficacy of the evidence, all right, when it comes to immune systems and the improvement and the things that can be helpful with that. I think all of us have some of us have a lot of information in that area that you want to share at this time, but now's not a good time to share it, and now's not a good time to get in an argument with the Federal Trade Commission about that. Save that for a later time. And our profession really needs to organize around that, okay, for us to be better prepared to make any claims. And so, again, if that bothers what I've said, so be it. But this is the advice that I'm giving to keep you off the front page of your newspaper, all right? And then just keep in mind that throughout this whole thing, we need to maintain our HIPAA compliance, all right? And that means not discussing patients who could be positive or carriers or that type of thing. And so remind your staff, make sure that everything is confidential. The only thing that HIPAA has loosened up a little bit on is the technology that you can use for telehealth. And so they're holding back on finding people for not using a compliant technology. And of course, it has to be non-public facing, and we get into that in that module that I referred to earlier. But just be aware that we're still under those HIPAA requirements. Now, another great piece of information, and I finished watching it. It's on the Small Business Administration Disaster Relief Tax Credit. I referred to it earlier in that $2 trillion package that is coming through. And this is something that you want to listen to. And again, this is one of those things that you want to keep up on and to go ahead and make an application for that. It doesn't, if you apply and get approved, it doesn't mean you have to accept it. But there is a recommendation that you take some action on that and at least get your clinic and yourself set up. Again, we don't have a crystal ball to know how long this is going to last or be drawn out or whatever. And so be prudent about these things as they come through. Listen to it, understand it, digest it, and then take action if need be. And then, of course, I want to do a plug for my good friend, Dr. Steve Conway, and his good friends who are going to be talking about the FMLA expansion and what employers need to know about that Families First Coronavirus Response Act. And that's going to be on Friday the 27th. That's tomorrow. And there's a link right there for you to click on and register and join them. They are employment labor law attorneys. And that'll be another very important part to understand about how that area has been expanded. Typically, there's been exemptions in place for small businesses under 50 employees. However, now that's been expanded, and you need to know what your responsibilities would be if one of your staff members contracted the COVID-19 or had to go home to take care of either children that are home from school or maybe a family member that is COVID-19 has contracted COVID-19. And then the last thing, and this only impacts a small number of chiropractic clinicians, is that the quality payment program reporting for 2019 was scheduled to be deadlined the end of March, now got pushed to April 30th. And of course, that link will give you more information about that as well. And so this link that the CDC has is a link that I use every day, and it gives you kind of a situation summary. And you know, there's so much information out there. Many of us have just seriously worked, night and day, frankly, to try to get our arms around this over the last week and a half, 2 weeks, and to be able to deliver these resources and all of that to you. Well, this is one of those links that help me as being one of those people that are trying to understand things, draw conclusions quickly, and get information out. And so I wanted to share that with you so that you could use it. You can get on it if it's once a day or every other day, and just kind of keep an eye on how's the CDC processing all this information and getting it out and all of that. And so that's a really good source. And then again, stay informed. And what we've done is we've created this landing page here for COVID-19. You can use that link, and you will see upcoming webinars to stay informed if you just want to go to the website. You can also, again, earlier on, I believe I showed where you can put your name and email address in if you want to receive updates. And so, the updates that we are putting out are things that either the CDC has published or things that have come out that are very pertinent to what we have within our businesses and what we are working on within our businesses. And so, again, we hope that you'll join us. We have a strong lineup of resources. You will hear from us every week, sometimes maybe 2 or 3 times during the week, depending on what needs to get out there. But we are convicted and convinced this is what we need to do. And when I say we, I'm talking about the full lineup at ChiroHealthUSA and of course eChiro and Chiro Armor. And there's so many other leaders within your state association that we just give kudos to. Everybody is doing their best right now to pull things together and to help our profession, to help you, our colleagues. And so if you have any questions and also answers, we would take those. But any questions or comments, please feel free to give us a call, drop us an email, and we really appreciate you joining us. So again, I want to thank ChiroHealthUSA. They've done just such an awesome job. They are so generous there. All the staff, Dr. Foxworth and Christy, thank you so much for the work you do. I know way too much how much work all of you and your staff and have been putting into this. And anyway, our profession thanks you as well. So this has been Dr. Scott Munsterman. Looking forward to you joining us with some further discussion about this public health crisis. And what we want to do too, by the way, now is a great time to work on our practices, right? I mean, a lot of us have some time in our hands right now, more than what we want. Well, now is a great time to work on the practice. And so over the next weeks to come, we will be talking about that. And what do we need to do to make things better in the practice so that as we begin to re-entry, into normal daily routines, that we will have a business model that will work really well. All right. So stay tuned. Thanks for listening.
Hi. Okay, guys. We've got so many. I love all these chats. So I was trying to stay on top of this. All of the links that Dr. Scott talked about are in the chat box. So you can just go through there. You'll see them. They're highlighted in blue. If you click on the offers button that looks like the megaphone, it says visit resource page. It takes you directly to his resource page on the Big PA website, where a lot of this stuff is, again, listed. You can also go on the ChiroHealthUSA website /COVID. A lot of those resources are there too. But if you click on the resource page, it's going to open up another tab on your web browser right now and take you directly there. Make sure you bookmark it. Let's see. We have a lot of questions. Dr. Scott, do you have time for a few of these?
Oh, I sure do.
Okay. Let me go through here. There was one really good one that somebody sent me in a private message, and I was like, oh, I want to address this. Okay. Now I got to scroll down and find it. Here it is. If a patient calls and says they have tested positive and were treated in the office last week, do we have any legal responsibilities to notify patients?
No. And so here's the thing is that when you've identified and you've screened that patient positive, then they need to be quarantined and they need to stay home and seek medical help. So that's one of the things is we've read a lot about this. The CDC has not given healthcare providers any break in this. Matter of fact, there's been talk about if you are symptomatic, make sure that you cover your mouth and still stay working. I mean, there's been dialogue about that. And so just keep in mind, we are clinicians, we're healthcare providers, and we're providing an essential service. And so we do our best. We keep that clean, safe clinical environment, like we talked about earlier, having that response. We be judicious about our patient care, who we are treating, and the acute nature of it and all of that. And then, of course, do what we can to help educate our patients on what's going on and stay very focused. I just saw a question pop up, mask or not to mask, right? And frankly, what I tell our doctors is that keep an eye on the statistics of those reportable cases in your county. I mean, that's where it's close to home. And so as you think about how those cases begin to become reported, then use your discretion on, maybe it's time to go ahead and wear a mask and use gloves and all that. Certainly sooner rather than later would be a good rule to follow. But, screening your patients, making sure that they quarantine. We gave you the quarantine guidelines, as far as that goes. So, yeah.
So I've seen this question come up a couple of times. Is there a screening questionnaire template that's available that they can print?
Yeah, and so the screening part, there is a downloadable screening. The CDC has information now. They came out with it late last week. Those links have been shared, and so I would recommend just going right to the CDC website with the links that we've provided there, and then they'll be able to download signs that they can go on the front door and signs inside the clinic. And then also information that if somebody is sick, recommendations on what they need to do, and then also recommendations for you and your clinic. And initially, early last week, we prepared a lot of those documents and summarized it and put them out there. And now the CDC has come up with information that looks way nicer than what we put together. So I really would just direct you right to the CDC site for that information now.
So this is another question about what if basically the clinic may have come in contact with someone who is tested positive. What if it is a staff person that has been in the office? They were not symptomatic while in the clinic, but they have now tested positive. What are our requirements for quarantine and legally notifying patients?
Yeah, and again, I have not heard of any legal notification requirements on that. And again, we're healthcare providers. You screen the individual. You make sure that if they are positive on their screening, that they don't come into the clinic, that they are referred to for medical care. And then again, keeping a clean and safe work environment. So.
So I've read on a couple of the chiropractic Facebook groups that certain insurance companies will insurance companies will cover telehealth services for chiropractors and some won't. How do we find this out prior to a telehealth visit?
Yeah, and so the telehealth module that we did, that I know you've gotten the link out there, Christy, now a couple of different times, it goes into that in detail, and there are some really good resources that will bring you into what the state guidelines are. And so during the module, I walk you through what is the process you need to be thinking about. We touched on it, real briefly here in this module, but very first and foremost, you have to check your state guidelines and see what your state law has to say about that. Check with your board of examiners, and then move on down into discerning, okay, insurance companies, what particular policies do they have in that regard, and what modifiers do they need to use? And so all that information, again, it's not a soundbite that I can give you. You really need to study it in its entirety and understand telehealth in general, and then you'll be able to kind of move forward and do the investigating yourself within your own state.
Let's see. Somebody was asking if we were going to be discussing the telehealth, like codes fees for telehealth tomorrow, and the answer is no. That webinar is with an employment law firm who specializes in employment law, and it's all about FMLA and all of the changes that have taken place, and what your responsibilities are as a provider. But again, I just reposted that link for telehealth, the telehealth webinar that was recorded. So please go check that out. And then let's see. I'm surprised there is no obligation to inform patients that they may have come in contact with a patient who tested positive. That's the thing about HIPAA.
Mm-hmm. Right. Yep. So.
Are we able to actively care for and treat COVID-19 positive patients?
I would recommend that if they have an acute neuromusculoskeletal condition, that if you are in their home and you know that they are sick, certainly if you feel that you need to take care of them for that condition, for the acute neuromusculoskeletal condition, that you be very careful, masking up, gloving up, washing your hands, all of that. And you certainly need to take every precaution to protect yourself in the event that you do that. So it would really be left up to your discretion as a clinician at that point.
Jared, you have a great question about how would you handle paying an employee who's been out of the country and they will be off work for over 3 weeks now? That is a great question for tomorrow's webinar with our employment attorneys. So I would definitely attend that one. If not, just register, because I know these webinar times are all over the place because there's no one size fits all time. But register for it. You will get a link to the webinar recording immediately afterward. And a couple of y'all have emailed me about getting a copy of this recording because Dr. Munsterman talks fast like I do. And you're all going to get it in an hour. And it will show all of the questions asked. It will have all the links pop up in the chat just like it did now. If you think of a question that you didn't ask this time and you input it in there, it's going to email Dr. Munsterman. So he will get it and then he can respond back to you. Somebody put on here that they tried billing Medicare for telehealth from last Sunday and just received an EOB that they rejected it and don't pay for our specialty for this service.
Yeah, and the reason being is because Medicare only covers manipulation, right? Procedure. Mm-hmm. And so that's correct. And they don't cover, evaluation and management services or other services that could be delivered via telehealth are non-covered services under Medicare. Medicare has expanded their telehealth to other medical providers, though. And so a lot of telehealth now is getting opened up, the accessibility of it. And I think we'll see some really neat things come out of this at the end of the bell curve.
Okay, let's see. Should the doctor be quarantined if a patient tests positive?
That's a really great question. And I think what you have to do is you need to follow the quarantine recommendations if you've come in contact with somebody. And this is, following up with your public health officials as well and getting guidance would be welcomed in cases like this. And as we learn more and get more information out there about this, there's going to be more considerations that we need to make here in the weeks to come in regards to that. So, and certainly getting tested and all of that, but follow those quarantine guidelines that we talked about in this module. That'll be very important for you to do.
Great. Okay. Is it just a strong recommendation for chiropractors to screen patients by checking vitals, or is that a requirement?
I would call it a requirement because we're in a public health crisis. And so that's a whole different line of duty, if you will, as clinicians. And so screening your patients, taking their body temp when they come in, that's being responsible as a clinician during this public health crisis. And I just, as a matter of fact, I saw information from my board of examiners just got in my inbox here just a couple of hours ago, and that's pretty much what they said. That we do have a duty to make sure that we are screening and that we are, cognizant of what is going on in this public health crisis. Mm-hmm.
Oh, he says, do we take the body temp only or other vitals as well?
I recommend that we take all their vitals because, again, cough, difficulty breathing, you want to monitor their respiration, and it's just good to do all the vital signs, including body temp.
I agree. In fact, we had 2 doctor's appointments in the last week, and we got all of our vitals taken at every single one of them, including our chiropractor. Patients who live in NYC and live where our office is as well, would you suggest that we have them do self-quarantine upon their return, live or maybe visited New York City? I think anytime you have patients or staff who've been to a hot zone, Seattle, Washington, California, New York, right now, Louisiana is a hot spot. What do you think, Dr. Scott? Should they be self-quarantined?
Yeah, well, I tell you what, it's all about who are they exposed to. So are they driving, from there to wherever you're at? Though that's a consideration. Certainly air travel is on the list that need to be quarantined now anywhere in the United States, a 2-week quarantine because you're exposed to more people. So, we just have to kind of think about it from an exposure perspective and do our best to use, pragmatism and common sense and some of those things and how we think it through. And again, keep reading. I mean, we're all trying to digest all this information as it comes through and make, good, statements or understandings of what's going on. And it's up to everybody to stay informed and be on that CDC website and certainly, keep asking the questions.
I agree. Let's see. This is a kind of a loaded question, and I'm pretty sure the answer to this one is no. But we have a doctor asking, is there a resource anywhere that determines whether we are considered essential or not? Because I know this is a hot topic in every state right now.
Yeah, and so there was some information that came out of Homeland Security that defines essential services. And what's interesting is that it has within the healthcare provider part, it doesn't have us listed, but it has dentists and physical therapists, but then they go on to say, and others. And so from a federal level, it could possibly be argued that we are inside of that essential service definition. However, again, it's going to be remanded to the governors of those states that are going to determine when they put shelter in place, executed orders, that they're going to determine who should stay open and who should not. So you just have to go by what your state says.
Awesome. So there's a lot of questions in here about telehealth. So here's what I'm going to say. The link is in here. Go visit that. If you missed it because it fell somewhere in you should be able to scroll down in your chat message to get a link for that. If not, click on the little offers icon and you can go directly to the resource page. Watch that. Dr. Munsterman and I were just talking about this morning. We are going to address telehealth in an additional webinar. We're also working with the states because the bottom line is the rules and regulations in every state are going to be different. And so it's kind of hard to address it globally. So we've talked to some states about doing one that's more specific to your rules and regulations. So again, this is such a new concept for chiropractic. So bear with us because we don't have all the answers, but we're working on it.
Yep, that's right.
Oh, I love your response, Kim. Y'all, if y'all don't know, Kim Driggers is like the legal eagle genius at the Florida Chiropractic Association. On top of that, she is just fabulous on stage. And she wrote, physicians are listed in the Homeland Security memo. So if your state defines DCs as physicians, we argue you are included. Girl, big fan. Can y'all tell? I just get gushy. Okay, let's see. Do we deny care entry for patients with allergy symptoms? No fever for now. Ooh, that would be everybody in Mississippi. What do you think, Dr. Munsterman?
Oh, I'm sorry, you cut out on me there.
I said, would you deny patients who have allergy symptoms, so similar to what COVID-19 symptoms would be, but they don't have a fever, or would you go ahead and treat them?
No, I would screen those, and I would not. I would consider them possibly positive for screening, and I would screen them out of the clinic at this stage of the game and at this time. It'd be better to be safe than sorry.
Let's see. Federally, we are considered physicians. I love y'all are such a chatty bunch. Okay, so here's the deal: that we are down to the last minute. And yes, Kim, we have a request if you could post your link for the Homeland Security memo. That would be super. Thank you so much. So I just want to remind everybody. Where is it? Trying to get to this page really quick. We do have another webinar. We will continue to do webinars and update our resources page here and at Best Practices Academy and with Chiro Armor every day with all the new information that is coming out. Oh, it's telling me you're on the wrong page. Y'all are going to see all this other junk on my computer screen if I don't fix this. So don't forget, just again, we're putting the recordings here. They're the same accessibility as they always are. Yep, it sure will be archived. Every one of them, girl. You know, I don't ever deny y'all access to all of these fabulous. Yep, that's telling me I have stuff to. And we never deny y'all access to education. So, you know, I'll show y'all how to access that in a minute. But tomorrow, go ahead and register for this. There's a lot of responsibilities. I've had people say, but you know, we have less than 50 employees. It doesn't apply to me. That is not necessarily the case. And you need to find out why. Who better to hear from this than lawyers who specialize in employment law. So we're super excited about that. We'll be posting more webinars, sending out updated emails to let y'all know what we're going to be talking about and to address your concerns and how to deal with all of this craziness with COVID-19. As always, everything is being moved to the archive. So you can go in here, list chronologically is my favorite. If you want to do search webinars and only see those that have to do with COVID-19, put it there, or documentation, or whatever the topic may be. That is how you can find those. Or by speaker, you can even type in Dr. Munsterman and it will pop up. And it'll show you every webinar he's ever done for us. So, and again, it's on here, previous webinars that have already taken place. The how to stay proactive during a crisis. SBA disaster relief, which was yesterday. We had over 1,000 attendees on that one live, 1,700 registered. Here's some updated news, downloads, and free resources from some of our trusted partners. So check it out. Kim, thank you so much. This is awesome. Did I mention how much I love this woman? She's fantastic. She's a great resource for asking questions, and I have them all the time. I'm so glad y'all enjoyed that. All righty. Any other questions, y'all email me. I'll share them with Dr. Munsterman. Anything you need, don't hesitate to let me know. Y'all know how to reach me, Christy at ChiroHealthUSA.com. You probably have 3 emails in your inbox from me already, but we'll keep you updated, let you know what's coming up. We'll have some more webinars next week to address the situation for y'all and keep y'all updated on all of the craziness that's going on. I want to thank y'all for taking time out of your crazy days and everything that you're doing to be here with us. If you need anything, let me know. I'll see y'all tomorrow. Bye.